Yes, you've seen that is the heart, cardiovascular, yes, system. Uh, fanya aje? There, the images that you're seeing right there are important images. Are important images. Look at those images. This is your heart. This one is your heart, and there are several factors that several things that we need to check out when we discuss about this. Let me see if yes, that way. I think that way has become so close and it's so well seen because I need uh, clear vision when I need clear vision when yeah. Come on. I need clear vision when it comes to yes, I think that one is the same. It's good. Now the heart has vessels, and the vessels we need to know some things that are normal factors when it comes to the heart. When it comes to the heart, the general knowledge when it comes to the heart, we need to know some general knowledges when it comes to the heart. Some general knowledge that when it comes to the heart are like, what does the heart do? The heart pumps blood. See, it is normal that the heart pumps blood, and as the heart pumps blood, as the heart pumps blood, we should know some things like how does it pump, how does it work, the heart as your pump of the body, how does it work? It is a very important part. I'm setting up things, guys, so be patient. Be patient as we talk at sometimes, when you start things, you should be patient. Now, let me get this first. This one. Let's, yes, there. Now, the facts about the heart. The heart beats around 100,000 times a day. Imagine, the heart beats 100,000 times a day, around 2.5 billion times during an average lifetime. Your average lifetime, in your average lifetime, the heart beats like 2.5 billion times. Just imagine, 2.5 billion times. A woman's heart beat beats an average of 8 beats more per minute than a man's heart. So a woman's heart beats more faster than a man's heart. You see, normally a woman's heart beats more faster than a man's, and it beats 8 times more than a man's heart. And the sounds that the heart produces, the sounds that the heart produces, the sounds that the heart produces, hmm, the sounds of a heartbeat are caused by the closing of the heart valves. When they close and open, you hear lap, dap, lap, dap, lap, dap, lap, dap, lap, dap. You know that that is the heart closing and the heart opening. See, those are the simple facts that we have when it comes to heart, the heart. Now, I'm trying to fix this so that I think people will see better that it's there. Those are the facts that we have normally. The heart provides blood to every part of the body except for the cornea of the heart. So the cornea of your eye, the cornea of your eye, which is the outer layer of your eye, does not receive blood. It has to remain transparent to reflect light. So if blood goes there, what will happen? You will have some problems when it comes to checking. Those are facts. But remember, we have said that it's important you listen to this. The heart beats around 100 times a day. In your lifetime, it can beat around 2.5 billion times. It can beat like 2.5 billion. And then the woman's heart beats faster, beats at an average of 8 beats more per minute than a man's heart. So a woman's heart beats faster than a man's heart. We will see why a woman's heart beats faster. Today we have some diagrams here, and we will know why the diagrams are there. The heart provides blood to every part of the body except the cornea of the heart, of the eye. So blood is not supposed to go to your cornea of the eye. Why? Because it will not be transparent. It needs to be transparent for you to see. That is the only part of your body that the heart does not supply blood. You get it? The sounds of the heart, where does they come? The heart has got the valves. The valves, we will learn them today. The valves, they have got the valves. You see, these ones are valves. The heart has got some valves there. Barbara is here, the king. Hello. Today I'm talking about the heart, because when we start dealing with problems concerning the heart, Barbara's world, J. King, welcome to the platform. When we will start talking about problems about the heart, everyone should be knowing about the problems and the normal. So today I'm talking about the normal, how the heart itself is functioning, how the heart itself is functioning. The blood vessels in an adult are around 100,000 kilometers long in total. Just imagine the blood vessels, the veins, the capillaries, and the arteries. They are like 100,000 kilometers. If you combine them and form a straight line, they are like 100,000 kilometers. Just imagine. Hmm? That is funny. Now, the research shows that deadly heart attacks are more likely to occur on Monday On Monday is where heart attacks happens. We are going through general facts about the heart. The blood vessel. Now, the heart provides blood to every part of the body. We have said except the cornea. Today we're gonna learn about how blood flows, the natural flow of blood in the body, and how the blood flows. Let me see if this can come. Yeah. I can see that is the heart. That is the image of the heart. The one that you are seeing there, it is the image of the heart. The diagram that I've drawn, Uncle told me that I know how to draw. Hmm? So those are the parts of the blood. The heart has got four chambers. The heart has got four chambers. It has the right atrium, the right atrium. This one is the right atrium. This space you are seeing here is the right atrium. And then the heart has got the right ventricle. This space that you are seeing here is the right ventricle. This one is the right ventricle. And then it has got the left atrium, left atrium. I'm writing them down so that I can post them here. It has got the left atrium and the left ventricle. The left ventricle. So those ones are this one will be here. The left atrium, the left ventricle, this one will be here. Those are chambers of the heart. Chambers of the heart. Right atrium, right ventricle, left atrium, left ventricle. So as I speak here, we're gonna say this. The heart has got the chambers where the blood comes and fills. Where the blood comes and fills. I have to stick this one here. You know, for blood to have enough capacity to move. Hey, Marie is here. Marie wants to listen to how the heart pumps, how the heart pumps blood and how the heart circulates blood. Not so that you can know. This is the normal. We are dealing with the normal today. Welcome, Marie. Marie is my daughter, my younger daughter, my last born. Marie is my last born. Now, this is what I'm saying. For blood to be pumped from your heart, there is a particular force that is needed. So if this is a bottle and this is a space of, if blood fills, let's say it is the right atrium, if blood fills here and then you push, it will have a force. And that force is what opens the valves. It's what opens the valves. Now the valves are, today we are learning slowly by slowly. Now, in any ventricle, like let's take the right ventricle where I'm drawing a valve. I'm drawing a valve. This is the ventricle. I'm drawing so that people can understand at least what I mean. There is something called the vena cava. We'll learn about it. Now, this is the valve. I don't know where I put the valve. I think here. This is the valve. You see, it is important to note when blood comes in this is the right the right ventricle here, the right ventricle. When blood comes in the right ventricle, it finds when these valves are closed. You get it? So when it finds these valves are closed, blood fills here. So it takes time to fill. That it can go down after the ventricles are relaxed, so that blood can come to the right ventricle. Blood can come to the right ventricle. You see that? That one is the diagram. This is the pulmonary. So this is how it happens. When it is filled here, the right ventricle, the work of the valve is to hold blood, so that blood cannot flow directly to the ventricle. If blood flows directly to the right ventricle, it will not have pressure to go to the pulmonary valve and go up. So the work of the valves, just a minute, I take something. Yes. I was taking some water. Now we continue. The work of the valves is to make sure that blood is not going back. Blood is not going back where it came from. So when this one is the valve that makes this part. What I've drawn is this part. When blood goes back to the right ventricle, these valves make sure when this ventricle is pushing blood going to the pulmonary valves up to the lungs, it makes sure that some blood is not coming. You see, when it is pushing blood like this, it will take blood to the lungs. And when it is taking blood to the lungs, it will make sure blood is not going back to the atrium. So this is how the blood circulates. We have the valves here, the valves at the atrium. We have the valves, they are called pulmonary atrium, and then we have another one called here the aortic. This is called the aortic valves because they are at the outer. And then we have tricuspid valves here, tricuspid valves. We have mitral valves. The work of the valves is to make sure that blood is not flowing back. Even in water system, when plumbers go home and they put something that makes sure water cannot reverse. You see, without the valves, you will find that when blood comes inside the atrium, what will happen when it is being pushed to the pulmonary to go to the lungs? Some blood will go back to the left atrium. So the work of these valves is to make sure that blood is not going back. Christine Long, welcome to the platform. I'm introducing a very important topic. So we have said the heart has got 4 chambers. One is right atrium, right ventricle, here the ventricle, where it takes blood before it pushes, and then we have the left ventricle and the right atrium. The right, we have two, you separate this heart like this, twice. Hello, Benjamin, all watching. So, thanks. Now, you separate this heart like this. 4 chambers, right atrium, right atrium, this side, right atrium, and then now we have the left ventricle, and then the other one we have the right atrium, right ventricle, and then we have another one here, which is the right atrium, the left atrium, and the left ventricle. So when I'm looking at you like this heart that you see here is lying on me like this. Hello, Benjamin, and everyone. Thanks, Beauty, on coming. So look at this heart the way I've placed it, and look at me. That is how it is seated on me. It is seated on me like this. The general facts we have said: women heart beats 8 times more than men. So your women's heart beat faster than men. Now this is how the heart, the valves of the heart. Let me get another paper so that I can write the valves of the heart. If you have any question about the heart, please ask. I'm just introducing a topic on circulation. Now, we have these valves that make sure blood is not going back to the right atria. These valves here, which are called tricuspid, tricuspid valve. These valves, they make sure that when blood is coming to here to be pushed to the lungs, it makes sure that blood cannot go back to the, and you know, when blood is coming to the heart, it has no oxygen. So if you are watching, continue giving me those likes. Today you see I'm an artist. Today I'm an artist. I've drawn a very good picture of the heart. Give me a like for being an artist. Now, we have started by tricuspid valve. And then there is another valve that makes sure blood does not go back to the ventricle when it is pushed to the lungs. When it is pushed to the lungs, because the purpose of the heart is one, blood to yes, it looks good. Thank you, Christine Long. The purpose of the heart is to make sure blood has gone to the lungs, oxygen is exchanged, and then after oxygen is exchanged, the oxygenated blood, the blood that has oxygen, has gone to the body. And that is what I'm discussing today. It looks like you are good in technical drawing. Thank you, Kingred. Now, we have this valve called the pulmonary valve, which makes sure that when blood is taken to the lungs, this pipe, this one that is here, it makes sure that blood is going to the, but if we don't have this pulmonary valve, which is pulmonary valve, it means that blood will go back to the ventricles. So this valve helps blood not to go back to the ventricles. It's here. It makes sure that blood does not go back to the ventricles. It makes sure enough blood goes away from the ventricle, this one, to the heart. You know, when heart pumps like this. So these ventricles, look at my fingers. My fingers are these ventricles. So when they pump, it means they are pumping blood. They are pumping blood going to, it's going to the lungs to get oxygen. That is how it is pumped. But blood from the lungs, how does it come? It comes back through this chamber here. After it has come from the lungs, now it has oxygen. It comes here. And here it will get mitral valve. What is the work of mitral valves? It helps so that blood can be held as this one is being pumped out of the body. What holds blood not to come back to the ventricles, to go to the body, and to go to the head? What holds blood is this aortic valve. Aortic, it's called like the aorta, aortic valve, this one, aortic valve. Now, this is how blood circulates. Today, I'm just introducing how, but if you have any question concerning the heart, please ask me, ask the heart. Now, aortic, I've not written aortic valve, aortic valve. Aortic valve. Now, you see, it's very important to note that we put this one where here. This one, where will I put this one? Here. Here, so that people can read these papers and understand. Pulmonary, we have talked about the valves. The work of the valves is to make sure that blood does not go back. So I want to explain how the blood circulation works in your body, how blood flows through the heart, so that you can get oxygen in your brain, so that you can get oxygen everywhere around your tissues. And this is the normal circulation. After the normal circulation of the heart, we will see problems. Not today. Today I'm just introducing. Today I'm introducing how the heart flows, how the heart flows blood. What should be a normal circulation process of the heart? What should be a normal circulation process? So we have said, hi Sandra, welcome to the platform. So we have said the valves that we have are one, this one, tricuspid valve at the atrium. We have pulmonary valves that goes to the lungs. We have another mitral valves here from the lungs, and then we have aortic valve to the body, Now, your blood that is not rich in oxygen, blood that is not rich in oxygen, this is what happens to you. The vein system, the veins around your system, they take blood that is not rich in oxygen from your capillaries, rich in oxygen, and then they take to this blood vessel here that is coming from down. This blood vessel that is very long, it has two blood vessels, this one. This blood vessel is called the vena cava. It accumulates deoxygenated blood, oxygen less blood. It does not have oxygen. And then we have the ascending and descending, whereby it brings to the first chamber of the heart here. So blood that has less oxygen enters to this. You get it? Blood that has less oxygen enters to this chamber of the heart. We have said the heart has four chambers. The first one is the right atrium, this chamber here, this one. The second one is the right ventricle, the right ventricle here, where the blood flows. And then we have the other one, which is the left atrium, VM, and then we have the left ventricle here. So the first one, where blood that has no oxygen settles. Good evening, dog. Tuned in with a pen and a notebook. Thank you so much, Ritsu. Thank you so much. Note this so that when we are going to have some explanation of some problems, you will be there understanding how these problems of the heart comes in. Now, blood comes in. Now, your veins around your body are connected. Veins. They carry blood that has no oxygen. It has less nutrients. And you need to circulate, you need to get oxygen. So it takes peaks from the capillaries. And then it brings to this vessel that is called the vena cava of the heart, to the right atrium. It finds tricuspid valve closed so that it cannot go down. You get it? So when it finds, it feels this right atrium. And as it feels, the right atrium, this tricuspid valve closing means in the right ventricle, blood is being pushed to the lungs, is being pushed to the lungs. When this one is closed, this is a muscle. This one is ventricular muscle. When it is closed, it means blood is being pushed to the lungs. Because if you push blood to the lungs while this one is open, blood will go back to the ventricle. You get it? You understand? So we are not supposed to return back blood to the atrium. The blood is supposed to go through pulmonary valves to the lungs to get oxygen. So when blood reaches here, it finds this tricuspid valve, these valves closed, so that when this ventricle has contracted and is pushing blood to the lungs, blood is not getting back to the ventricle. That is the first step, how blood gets to your heart. And then when the blood already pushed to the lungs, the pulmonary valves close. So this one's open. When this one closed, this one, the pulmonary valve open, so that, you know what? So that live, love, love. We always live, love, and love always. Yes, thanks a lot for being here as we talk about matters concerning the heart. It is a short session of how the blood flows around the heart. So when you have pushed blood to the lungs, it means this ventricle is empty, and now we need blood, other blood too. So this tricuspid, this one closes and this one opens. So blood moves to the, now blood has come here, blood has come here. This one needs to open now, and this one closes. It comes to the left ventricle here. So when it is in the left ventricle here, when it is in the left ventricle, blood is filling, waiting to be pushed. There is another thing that is happening. What is happening as this one is filling? Blood from the lungs. Blood from the lungs is coming in. And where do blood from the lung come in and it's oxygenated? It has oxygen. The main purpose of the heart is to bring blood that has oxygen. Bring blood that has oxygen to the lungs, to the heart, and then the heart circulates it to the body. Now, when it comes from pulmonary arteries, these ones, to this chamber, the fourth chamber, which is the left atrium. The fourth chamber here, which is the left atrium, this left atrium here, the left atrium. You see, as this one is filling up from here, more blood is coming to the heart. You get it? More blood is coming to the heart that has oxygen, because when it was being pushed, it went to the lungs, and the lungs were getting more oxygen. The red blood cell exchange of the lungs as you breathe. The red blood cells are exchanging oxygen and removing CO2, removing carbon dioxide. You get it? Rich soup. Thanks a lot for following. So, when it is here, this one is closed. This one is closed here. It is waiting to be filled. And when it is closed, there is an important thing that is happening. This, anytime the atrium is closed, it means the ventricles are pushing. So when this one is closed, oxygenated blood that came before here is pushed to the outer. Is pushed to the outer. And the outer is the most important vessel in your body, because the outer takes blood around your body to all tissues. And you know what? The outer itself have got some branches. Left coronary artery here, left coronary artery here that goes to your heart. Your heart needs oxygen. So left coronary artery takes it to there. If you have any question concerning anything, today is I'm just explaining how the heart. We have started a week of cardiovascular, cardiac issues, the heart and the hypertension. So this short session will help us understand the problems. There are two such short sessions. One is this one, the circulation of the heart, and then there is the second one, circulation of blood in the kidneys. Kidneys has two divided roles. We will talk about circulation of blood in the kidneys, and we will talk about something called renin-angiotensinogen system, so that you know how your kidneys work. You get it? Oh, El Marie. Hi, doctor. Hi, El Marie. Welcome. So, blood has come here, the right ventricle. It has filled the ventricle. This one opens. You see, when this one closes, when it is very simple. When this valve closes, the aortic valves opens. You get it? It opens because it doesn't want blood to go back where it came from. And you've seen even here, when the tricuspid valve closes, the pulmonary valve opens because the ventricle is pushing blood. So when blood is coming from the lungs to, we have to take care of our hearts for sure. Thank you, Dr. Ben, because some people can Christine Long. Christine Long is saying we have to take care of our hearts because some people can come to break it. Heartbreaks. Heartbreaks are not good things. Yeah. That one, emotionally, heartbreaks are bad. Heartbreaks are not good things. Yes. But now we are talking about physiology. We are talking about physical things, not emotional things. Physical things. Now, we have talked about the heart. Now, you see, very important, note this. When this valve is closed, the pulmonary valves are open. When these valves, mitral valves are closed, the aortic valves are open. And it goes. That's why sometimes when you look at your heart on an ultrasound, if you have ever gone to check on the echo of your heart and you looked at that machine, you'll see your heart pumping, doing this, because this one is opening. Listen, this one is closing and this one is opening, and the opposite is happening the other side. The opposite is when this one is closing, this one is opening, and this one here is opening and this one is closing. You see, the opposite. So the heart will keep on doing this so that your blood can be pumped well. The muscles that help you pump blood to the heart are these muscles. The ones that help to bring down the atrium, they are above. So this is the simple circulation. The simple circulation of blood in a person is blood comes through to the right atrium, not this one. Blood comes to the right atrium. It goes down to the left ventricle. From the left ventricle, it opens the pulmonary artery. It goes to the pulmonary artery. Pulmonary valves are opened. It goes to the lungs. Then from the lungs, blood comes to the left atrium, whereby it finds the mitral valves are closed because the blood from the ventricles is pushing to the body. But when they are open, Margaret in Norway, welcome. When they are open, it comes here. It comes down here and then pushes again to the heart. You get it? That is the simple explanation of how the heart works. We talked about the chest pains. We talked about how the heart is. Now I will repeat some parts of the as we finish. Anyone with a question or understanding or something of sort, Please come through. I will explain. I will explain. I think today I've become a lecturer with drawings. Um, the heart has valves. Simple. These valves help blood not to go back as it pushes the blood to go where it's supposed to be. So we have seen the oxygenated blood from the right atrium. The main valve is tricuspid valve, and then we have pulmonary valve, pulmonary circulation. Yes, this circulation is where blood is going to the lungs, and then from the lungs, blood comes back to the heart when it has. Thank you so much, Margaret in Norway. When it has oxygen, when it has oxygen. So when it comes back to the chamber, right, left atrium, it comes back down here to the left atrium and then goes up. Now, the heart itself has got a layer on here on top of it. Eh? The layers of the heart. The inside layer is called the endocardium. And then the outside part is called the pericardium. When you have a problem and then some fluids are coming to the layers of the heart here, the layers of the heart, I think everyone have understood about circulation, how the blood comes from the veins to the main artery, which is the outer. The arteries, there is the arteries in your body carry blood that has oxygen, and the main artery is called the outer. This one that bring from the left ventricle to the body. It is the outer. But there is one artery that carries blood that is not having oxygen. This artery is called pulmonary artery. This one, it is called the pulmonary artery, which takes blood to the lungs. You get it? Hmm? So, it is called the pulmonary artery. Sorry. Yes. Now, we continue and say the pulmonary vein brings deoxygenated blood. Now, we continue and say this. When there is a situation whereby your heart has filled with fluids to this layer of the heart, this layer of the heart. This is the pulmonary vein. This one is artery. When this layer of your heart, this one, this layer of your heart, the muscle part of your heart is filled with fluids, that is where you start having complications. We will see how these complications come, because when they are filled with fluid, you cannot pump blood as needed. You cannot pump blood as needed. It is called, any infection that happens to your heart is called pericarditis. Infection of the heart, it is called pericarditis. So if you have ever had a person who is always on a drug called digoxin and spironolactone, you have a person around. Thanks for the loves, people. Thanks for the loves. If you have ever meet a person with always having these drugs, know that this layer of the heart, the black one, the black layer that I've drawn here, this layer of the heart, just know that this person has fluid in the heart. And we will see which problems brings fluids in the heart. It is very important to know that taking care of your heart is life. Because if this heart does not pump blood as needed, you will have problems. You will have problems with your kidney, you will have problems with your pancreas, you will have problems with your liver, because the liver and the kidney and all sorts of, they get pressure from the heart, these ventricles, if they don't have energy to push the pressure, the kidney needs to get some pressure from the heart so that it can sieve your blood well. So, as we talk, today it was a circulation video on how the blood, herbs and spices here, welcome, on how the blood circulates. So if you're coming in, you'll read about how the heart circulates. So the main valves that carries your oxygenated blood and gives your body oxygen is the out. It is the main artery. Arteries in your body are deep. You can't see them. You can't see them. The ones that you see on the peripheries are the veins. The main vein of your heart is called the main vein of your heart is called the vena cava. The vena cava is the main vein of your heart because it carries deoxygenated blood. But there is some funny thing that happens in the heart. The pulmonary vein, because it is from the heart, the lungs, it is called a vein, and it is carrying oxygenated blood. Remember that the pulmonary vein, it is carrying oxygenated blood and it is from the lungs. On contra, pulmonary artery from the left ventricle, pulmonary artery. An artery, we have said it carries oxygenated blood, but pulmonary artery from the pulmonary left ventricle carries deoxygenated blood. Deoxygenated blood. That is something that God brought up, and we have to live with it. So we have said the heart pumping the normal. We have talked about the normal pumping of blood, whereby, I will repeat, it comes to the vena cava from inferior and superior, comes to the right ventricle. After it is pushed, this tricuspid valve is closed. This one opens. It goes to the heart, it goes to the lungs, it gets oxygen, and then you remove CO2. So red blood cells is our diet. What we eat helps to keep our heart healthy or even exercise. Yes, Christine Long, you see, when you are exercising, you are making your ventricles to continue beating and beating fast. You are breaking down some calories, and when you're breaking down some calories, you are removing some fats. The most important place when you are eating a lot of carbohydrates and some carbohydrates and starch are being turned into cholesterol and fats, they come at times and they stay around your heart here. So fats that are accumulated around your heart here, fats that are accumulated around your heart, let me say these are fat globulins. Fat globulins. They make your heart have a problem when it comes to pumping. So exercise burns them, and when you're burning a lot of calories, what you are doing is you are burning more cholesterol, because the first thing you burn is glucose, and when it is used up, your body starts to convert the cholesterols and fats into glucose. That process is called gluconeogenesis. Gluconeogenesis. So you burn these fats that are continuously accumulating around the heart, and the heart becomes flexible. Flexible. So it continues to work well. It is very important to note that exercise is a very important thing when it comes to the life of your heart. Why? Because there is this coronary artery here. This coronary artery serves this heart with oxygen. This coronary artery. So if you have a lot of cholesterol and this coronary artery is blocked, you see, as from the outer, from the oxygenated blood, the heart has got three divisions. And these divisions, one of it is called coronary artery. This division comes back to the heart, on the muscles of the heart, to give it oxygen. So when you are not exercising and burning the cholesterols as needed, what are you doing to your life? You are making this coronary artery to carry a lot of cholesterol. And as it carries a lot of cholesterol, this is what happens. Less oxygen will reach the muscles of the heart. Less oxygen. So if there is less oxygen in the muscles of the heart, what happens? Your heart starts to suffer something called ischemia, lack of oxygen. And you know, muscles of your body rely on oxygen so that they can survive. So it is very important, Christine Long, for you to exercise. Even someone, when he or she is from surgery, after heart surgery, we do some walking, we do some, so that the heart can pump and pump and pump. So you have seen it is important. So eating healthy helps. That question has come on several times, even from our afternoon topic, the morning topic from other people, about what to eat. It will come. There is a topic that is coming, and we will talk about uh, nutritional care about the heart. So that is how the blood flows, and from the heart, tomorrow I will do another session how the blood flows in your kidney. So the pressure from the heart and is pumped to the kidney, and the kidney gives you the strength to continue getting good nutrition. Anyone with any question before I leave? So we have said the valves are tricuspid, pulmonary, mitral, and aortic. And then we have said the chambers of the heart are right atrium, right ventricle, and left left atrium and left ventricle. And then the blood comes from the vena cava, which is the main vein. We have the top, the superior and the inferior vena cava, comes to the right atrium, find this the mitral valve closed. When the mitral valve is closed, this one is pushing blood to the heart. When it has done pushing blood to the lungs, it opens the pulmonary. This one comes in. The blood from here comes in, it closes. And then the same thing happens the other side. Blood from the lungs comes in to the left ventricle, to the left atrium. It finds the mitral valve closed. When it finds the mitral valve closed, blood is always pushed to the body. Blood is pushed to the body and even to the coronary artery, which brings blood back to the body when it is brought to the heart itself. So the process continues, and then, as before I finish, there are some electrical. You know, sometimes when a person has heart attack, you always see doctors take the shocks and put them on the chest, and they release the shock. Then someone's wake up. This heart has something that like electrical conducting system, which are called sinoatrial nodes. Sinoatrial nodes. There is sinoatrial nodes. Sinoatrial node. We have a minute. I want to bring that before I go. We have sinoatrial node. Uh, just a minute. Just a minute. There is something I really want to introduce about this heart that is very important. It is called conducting system of the heart. So the conducting system of the heart is electrical system. It is how the heart conducts the impulses, how the heart brings out the impulses. So there is sinoatrial node located at the right atrium. At the right atrium, the right atrium is here. So here is where we have the sinoatrial node. Sinoatrial node at the right atrium. And then we have another one called atrioventricular node. Eh? Located somewhere here. Located somewhere here. Atrioventricular node. And then we have the bundle of His. The bundle of His here. So when this one hits, it takes the electrical system here, and then it comes back to the bundle of His, and then we will talk about it one day. When it comes to the bundle of His, that is where now, your heart cannot pump if it is not given some energy or some electrical system. So those are the things that makes the heart, they keep on the heart pumping. It is a node that produces some electrical system to make your heart continuously pump. It sinoatrial node here pumps to this node here and then to the bundle of His, and then it gives your heart, all of your heart, the electrical system. Yes, you get it. Atrioventricular node is here. Atrioventricular node. So that one will come, but it will come when we are discussing about complications of the heart. So why do your heart pump? How does it get electrical impulses? The electrical impulses are brought by these nodes. There is a small node here called sinoatrial node that sends signal to the atrioventricular node around here. So here it sends to some fibers, the muscles, and then your heart continues pumping, continues pumping. I can see today we don't have so many questions. I was just introducing the heart circulation. So anyone with a question before I log out, tomorrow we will see how blood circulates in there, how blood circulates in your kidney. Anyone with a question? Anyone with a question? 2 minutes. I have 2 minutes. Anyone with any question concerning our topic here? I think everyone will. If you have not understood, you will watch slowly by slowly, and then we will see how everything goes. So, what type of test should we get to check the condition of our heart? What type of test? There is a question here, Herbs and Spices asks, what type of test should we do to check the condition of your heart? There are several tests that we can do, Herbs and Spice, including imaging. Including imaging. There is an X-ray. An X-ray, if you do an X-ray, if your heart has swollen or has a boot shaped because of some complications, we do X-rays to check it. So X-ray is one of them. We have an echo. Echo shows how the heart and the valves are behaving. Echo. You see, have you ever heard someone saying echo? Sorry, echocardiogram. Have you ever heard someone saying that I went to a hospital and I was told to do an echo? It is an invasive ultrasound test. It's like an ultrasound. Yes, it is like an ultrasound that shows inside how the heart is. It uses sound waves. So when the sound waves pass through your body, it shows how the heart behaves. You get it? There are several types of echocardiographs according to what the doctor has written to you. There are some other tests that are blood tests, like a doctor can decide to tell you to do a lipid profile. Lipid profile means is doing types of cholesterols to see if they are elevated. You see, cholesterols make your blood heavy. So your heart has a lot of work to pump a heavy fluid. You can do those tests like lipid profile. Lipid only means cholesterols. We have like 4 types of cholesterols. We have high density lipoprotein, we have low density lipoprotein, we have triglycerides, and we have total cholesterol. Those ones are the ones that we see. And then we have clotting factors. Maybe your doctor is suspecting that there are some clots that are causing blockages around the heart. Your doctor can decide to tell you do something called INR or prothrombin rate. Those are clotting factors that will help the doctor to find out if you have some clotting problems. You get it? There are so many tests that we can do, but it depends with the type of symptom and the complication that you are displaying. You get it? Those are tests that we do. There are so many tests. There is anti-streptomycin O tartar test, whereby when you have a problem with the bacteria that has been eating you and you are treated and you are not healing, the ASOT test, which is called anti-streptomycin O tartar, it means that you had a problem, you had a disease caused by streptococcus bacteria, and that bacteria left a toxin called streptomycin. So we are checking the level of the toxin in your blood, and sometimes it kills the heart. So here is where people with rheumatism, we do the test for people with rheumatism. There are some tests that we can do, like rheumatic factors. Rheumatic factors where people are arthritis positive and you have problems with some diseases. We can do several tests. It depends, herbs and spice. Those are some of the tests that we do to check how you are going on and how your heart is doing. The first test we usually do is X-ray and INR. And then any other question, my friends? Right here it is 10 at night. Right here it is 10:03. What are the first signs that show you have problem with your heart and you have to have it checked? Yes, a very important question. Signs to show you have problems with the heart. It depends with the complications that you have. Just a minute. One of them mostly is high BPs. Christine Long. BPs are always one sign that maybe the heart has a problem. But you see, blood pressure is a diverse sign because you may be having other problems of the veins and not really the heart. So the signs that we talked about them today, but I'll repeat it. Chest pain, tightness, pressure, burning sensation in the chest, left arm and neck, jaw and back pain. Those are the first signs. Chest pain. We talked about it on your previous discussion today. Shortness of breath. Sometimes you can have shortness of breath, difficulty in breathing during exercise, and worsens when you lie flat, common in heart failure. You see, it means that oxygen is deprivation of the brain. The heart has low capacity of pushing oxygen to the brain. And then we have palpitations, feeling of irregular or fast heartbeats, irregular or fast heartbeats, palpitations, feeling of irregular or fast heartbeats, palpitations. Those ones are some of the problems that you can have when you are undergoing heart complications, palpitations. Palpitations, I said, it is being aware or feeling your heartbeat. A person should not feel the heartbeat. Sometimes you can find that your legs are swelling. Your legs are swelling. Swelling of the leg is a sign that your heart is not giving enough pressure to the venules, or it is giving excess pressure to the arteries, and some fluids are getting away from mostly when you have hypertension, high blood pressure. It means maybe the heart is really pumping hard. The heart is really pumping hard, and some fluids are getting away from the blood flow, and they are going to the interstitial, to the muscles. So that is swelling edema of the feet, seen in right side heart failure. Right side heart failure, when your feet are swollen, let's come and see. Right heart, right ventricle, it means the right ventricle has no power to push blood. So you will find that this side of the right heart, it is swollen. If you look at an X-ray, your heart will look like a boot. I will find an X-ray that has a boot-shaped heart, you see. So the amount of fluid that is going to the lungs is less. So the one that is coming back is even more less. So if you have less fluid that is coming back to the heart, it means the one in your body, you are receiving less oxygenated blood with low volume. So there is no low return to the ventricle. Low return to the ventricle meaning some fluid is down there to the legs and some tissues, because your right ventricle has a problem. You get it? So you swell your feet. So when you start swelling feet and you push, it is called pitting edema. You find that if you push it where you have swollen, there is a pit. It leaves a hole. Know that maybe your right side of the ventricle has a problem. Yes? Dizziness and fainting. Continuous dizziness and fainting is a sign that there is a problem somewhere. Your heart is not getting enough oxygen to the brain. It has no power on pushing enough oxygen to the brain. So you need to do something. Persistent cough and wheezing may produce pink froth sputum when you suggest fluid in the lungs. And you see, fluids in the lungs, your heart is between the lungs. So when you have persistent cough and fluids are in the lungs, I will draw it means the lungs are pressuring the heart and it's struggling to push. That is where you find people coughing every time when the BP is high. Rapid or irregular pulse that is sometimes going so fast because the heart wants to pump blood faster to reach the brain. With extremities, the fingers that are cold. Cold fingers show that there is not enough perfusion of blood in the capillaries, because the capillaries are the ones which comes at the extremities. Cold fingers. You see, there are so many things. Cold sweats. And then the last one, which is very important, Christine Long, bluish palms. Bluish palms, which means low oxygen. When the red blood cell has no enough oxygen, it turns blue. But when it has enough oxygen, it is red. So when you check your palms and extremities and you see that you have blue extremities, just know there is a problem and your heart has a problem. I think I've answered that one so correctly. And if you want to know all the signs, you just say fat leg disc, fat leg disc. If you want to know the signs, just say fast fat leg disc. F is for fatigue. A is for angina, chest pain. T is for tachycardia, beating so fast. L is for leg swelling. A is for air hunger, dyspnea. Hmm? 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 Dizziness, D. And then S is sweating. and C is coffee. What can we do to prevent heart attack? Heart attack, we should do exercises. We should remain on cholesterol-free foods, because when the heart is getting veins that are closed, especially the coronary artery that has cholesterol and is not feeding the heart itself with enough oxygen, you will get heart attack. Veins and arteries that have embolism inside. Embolism is some cholesterols that are closing the way of blood to circulate. It means there is a problem and you need to remove it, and removing it is a process. So we will talk about nutritional care, but exercise is important, and we will see diseases that can cause heart attack very soon. Today we have introduced how the blood flows. We are almost 1 hour and 11 minutes. Thank you so much for everyone that has listened to me today. If we don't have any question, we will continue tomorrow, 16:30 East African time. Let's continue supporting each other and praying for each other to have a good life and maintain a good life. Thank you for coming through. Have a blessed day wherever you are. It is at night here. If it is daytime, wherever you are, be blessed. Meet tomorrow. Bye. See you. Have a blessed time.